earlier with Dr. Shyam. We had already a session with Dr. Shyam in Tamil, Vayomanasa Sanjeevani webinar. So the participants had requested another session in English. That's why we organized this. So Dr. Shyam is an alumni from NIMHANS. He did his PDF in addiction from NIMHANS. And now he's an assistant professor of psychiatry in Saveetha College, Medical College. So I think we are already running late. Can start off now. Dr. Shyam, it's up to you. You can start.
Hello, am I audible to everyone? Thank you. So, good evening, everyone. First of all, I'd like to thank Vayomanasa Sanjeevani team for giving me this opportunity. So today's topic is addiction and old age. Sometimes it may seem like addictions often happen in the young age or in the adulthood, but addiction during old age is often overlooked. To start with, we'll go to the definition of addiction. So what addiction means is that repeated and excessive use of a substance despite knowing the adverse effects. This is a simple definition of addiction. Often addiction is accompanied by certain physical changes and certain psychological changes so that both the body and the mind becomes dependent on the substance. Substance can be anything. It can be a drug like alcohol, tobacco, cocaine, cannabis, etc., etc. Or it can be some behaviors like excessive internet use, sex, pornography, gaming, or gambling. So whichever these drugs or these behaviors, when we are addicted to them, are physically and psychologically, we become dependent on those substances or those behaviors. In scientific terms, we don't use the word addiction, we use the word dependence. But how do people get dependent on certain drugs or certain behaviors? They often follow a stepwise progression. The very first, they start using the substance or the behavior. It's called the first use. The first use can be due to their own need for experimentation. They just wanted to know how alcohol is tasting or how alcohol intake feels like. Or sometimes the friends may introduce them to these drugs. Sometimes they may take it to forget some worries, to forget their bad experiences in life, etc. Then, so that is the first use. Then when they first use it, if they like it, they go on to use it more regularly. It is called regular use. In regular use, the person may be using it, say, in the weekends. Only in the weekends, they used to drink to enjoy themselves, to relieve the stress, etc. But during regular use, they have the distinction between health and their alcohol use or their smoking. So they may drink or smoke only during the weekends, or they may drink or smoke only during parties, only during some occasions. Wherein during the other days they will not use it. But when they regularly use the substance, they go on to something called heavy use, in which they start consuming more and more. They start consuming more than what they have actually intended to smoke or drink. And in heavy use, people also use it to manage their own mood. For example, hello? Yeah. So in heavy use, what they do is to manage their own emotions. For example, they had a bad day at office, they drink heavily. They had a bad day at due to some family issues, they drink heavily. So from regular use, people move on to heavy use, and they don't distinguish between whether it's a weekday or weekend. They start consuming it heavily on a daily basis. So heavy use or daily use then lead on to addiction or dependence. In addiction or dependence, the person becomes physically and mentally dependent on the substance. Without substance, they can't function. So as I already mentioned, it can be for a drug like alcohol, tobacco, etc., or for behaviors like internet use, pornography, gaming, and gambling. So, but what are the features? When we say a person is in addiction, what do we actually mean? The following are the points. One is the person has an intense desire to use the substance. This intense desire is called craving. So the person craves for using the substance, and they are constantly preoccupied. Even during work, they keep thinking about drinking. Even during some family function, they keep thinking about drinking. Even when they are with the family members, they are constantly thinking when they can have their next drink or when they can have their next smoke. So this preoccupation is also a feature of addiction. Neglect of other pleasurable activities. If you see, some people, when they initially start taking drugs, they may be able to enjoy the other activities as well. They may enjoy the drug use also. They may enjoy the other pleasures of life, like interacting with friends or doing something to get promoted at work, doing something related to their own enhancement, etc. But once they become dependent on some substances, no, they will neglect all these activities. They will neglect their family. They'll neglect their friends. They'll neglect their social life. They'll neglect their work. So everything goes on a negative spiral. This is called neglect of pleasurable activities. Later, the person develops unpleasant emotions or sensations. For example, a person who is dependent on smoking, if he is not smoking during that particular time, he may develop features like irritability, anger, excessive sweating, feeling anxious, etc. And also, in case of a person with alcohol, when they become dependent, they develop symptoms like tremors, which is shakiness of the hands, or they may develop anxiety, excessive fearfulness, increased heartbeat, uh, sleep disturbances, etc. So this is called withdrawal symptoms. These unpleasant physical and emotional symptoms are called withdrawal symptoms. These withdrawal symptoms are different for different substances. For alcohol, it is different. For tobacco, it is different. For cocaine or for ganja, it is different. So whichever substance the person is using, they develop those particular set of withdrawal symptoms. This also means that the person's addiction is even. The next is increasing the quantity of substance to derive the same effect. For example, a person who was drinking alcohol, initially with just 90 ml, they were able to feel the high. But over time, when they keep drinking daily, after a few months or a few years, the same 90 ml will not give the same kick. They have to increase the dose to 180 ml or 270 ml or 360 ml. Many times we see people who started with a very less quantity of alcohol. Over time, they increased it to a very large quantity, causing a lot of physical symptoms. So this is called tolerance. In science, we call it tolerance. They are able to increase the dose of drug to achieve the same effect. So the next is difficulty controlling the use. Many times, I've seen many people. They will think, okay, from tomorrow I won't be drinking. Let me stop it today. But they are not able to control that. They're not able to control the craving, and they're not able to control. Sometimes people say, from tomorrow I'll drink a very less quantity, and they may actually sit to drink, thinking that today I'll drink only one drink. Today I'll drink only 30 ml or only 60 ml. But once they start drinking, no, the changes in their brain triggers them to use it again and again. So they'll end up drinking something like 360 ml. They would have thought they would use only 30 ml or 60 ml, but they'll end up drinking somewhere around 360 ml. So this is called loss of control, difficulty in controlling the use of the drug. So all this will lead to the person not being able to fulfill their responsibilities in the family or in the occupation or in the society. Whatever responsibilities they may have, they won't be able to fulfill that due to this drug use. So to summarize everything again, an intense desire to drink, always being preoccupied with the drug, neglecting all the other activities, unpleasant physical or emotional symptoms when they try to stop it or when they try to reduce it, increasing the substance gradually to achieve the same effect, difficulty in controlling the quantity of substance use, and inability to fulfill the social occupational obligations. So when we think of all these symptoms, no, we can easily identify someone with dependence or addiction. So from now on, I will use the terms addiction and dependence interchangeably as they mean the same. So now that we have seen about the various features of addiction, let's move on to what happens in old age. So before going into addiction in old age, let us see the major problems faced by the senior citizens of the society. So one is major physical illnesses. Like every organ system, the with aging, every organ system undergoes a lot of changes, be it the liver, be it kidneys, be it the blood vessels, heart. So overall, the changes happen with aging can lead on to development of physical illnesses like diabetes, hypertension, stroke, heart disease, arthritis, etc. So all these physical illnesses, if we see, they come with a lot of restrictions. For example, uh, diabetes comes with the restriction that the person has to exercise daily, or the person has to follow the medications, follow a particular diet. If we take hypertension, the person has to consume less salt, or the person has to exercise. For stroke, if the person gets paralyzed, they'll be bedridden. If the person has weakness of their hands or legs, they'll have to use wheelchairs, or they'll have to use some walking aids or something. For heart disease, they have to minimize their physical activity. They can't climb stairs and all that. And for arthritis also, they can't squat for going for toilet, or they can't engage in physical activities as much they used to when they were adults. So old age puts a strain on the mobility of an individual. Many a times, for many individuals, this mobility or being active in the society or being active in the family, that seems to be their identity. So that identity gets broken in old age. When people say, you should not do this, you should not do that, you have to restrict yourself. So all these physical illnesses, they put a lot of strain on the person's mind. The second point is physical disability. As I mentioned, due to arthritis or due to some fractures, due to other cardiovascular illnesses, they have physical disability. They can't do things as efficiently as they were doing before. Visual and hearing impairment. We all know cataract and other visual issues are come up in the old age, and also hearing impairment. Then financial difficulties. Only a handful of adults plan properly for their adult for their old age through retirement plans or savings, etc. The remaining often end up spending everything on their children or on their other things like loans and all that. So they may not have much money for themselves, and many a times they may get disappointed when they thought their son or daughter would be helping them financially, but later, due to various reasons, they may not be able to get that benefit. So all these financial difficulties can also put them in a lot of stress.
I think Sir is not in contact. We will let him come back. Sir's contact is broken. Kindly wait, let him come back. Am I heard by everybody? Hello? Hello?
Yes, sir, it's audible.
Yeah, Char is not in contact. His contact is broken. So let him come back. Let him come back. You have his number, Mark? Shyam.
Yes, I will try contact.
Please try. Otherwise, just send it across to me also, Mark. I'll also try. I think his internet is broken. So we may have to wait for some time, sir, and then come back.
Yeah, he's joining back.
Thank you. Thank you. That's good. That's good. Hmm.
Mr. Jambanathan, you can speak about the so far he has narrated.
Yes, sir. See, okay.
You can take alive.
Okay. See, what has happened is, sorry, unfortunately, his internet has gone off.
Yes, yes.
He's not able to join back. He will definitely join back. But in the meanwhile, okay, sir, so far, he has been talking about what are all the effects of any type of addiction. See, one addiction is that any addiction starts only as a very, very small thing in our life. We start is that this is I'm going to do it only for one time. I will not repeat it, etc., etc. Like that, we start any addiction in our life like that. But over a period of time, what happens, the mind, we do not have definitely enough control over our mind. And the capacity of the addiction to pull us towards that makes us to use that addiction every day. And because of this addiction, what happens, we forget our other important duties. See, we very often find that people are not attending office properly. People are not attending to his work properly. What is happening, even in our agricultural labor, etc., etc., when they get addicted to agricultural labor or mason or carpenter or driver or any person, when they get addicted to a particular thing, over a period of time, they start, they want more and more and more, and they become, their productivity goes down. So this addiction is not only, this addiction can be either a substance. So like, there are I don't want to mention the names of the substance, but anyway, one immediate thing that comes to my mind is the heroin. So this kind of small, it is in the form of a chocolate or in the form of a powder or something like that. When the person takes it, he gets he gets a kick. That is what they say. But it is that he is not living in reality. He is not to live in some unreal things in the world. Therefore, that unreal thing the person likes. Therefore, he wants to enjoy that more and more and more. But what happens, this has got a cost. Nothing in this world comes to you without a cost. See, this kind of addiction has got a cost. What are all the costs for that? The first cost is that your various organs in the body is not going to function as they are expected to function. They start deteriorating by day, and then you are not, and then second problem is that you are getting is that you become irritated, especially when you are not able to take these kinds of addictions. Whatever a person is addicted to.
Now doctor is coming, I think.
Yeah. Let's wait. No, he has not yet joined.
But now there's some message is coming.
Yeah. Tell me, Misha ma'am.
He has joined, sir.
He has joined. Very good. Excellent. So this is some Tani Avardhanam, that's all. You Kacheris, you have got some Tani Avardhanam like that. Sorry. Okay. Now things are better. Yes. Doctor has joined back. Yes, doctor, you can kindly go ahead. Doctor? Doctor, you can go ahead, doctor. Please go ahead.
Yeah. Thank you.
Please
So
go.
we were discussing about the financial difficulties and lack of social support. Next point is therapeutic pessimism. So therapeutic pessimism is not the problem of the senior citizens. It is a problem of doctors and healthcare providers like me. So therapeutic pessimism means even if I treat this person with old age, what is going to happen? What good is it is going to make in society? That kind of mindset is called therapeutic pessimism. So therapeutic pessimism is widely prevalent, not just for addiction, for anything. Even if a person with old age complains of a lot of pain or some other difficulties, it is often given less value by the doctors and others in healthcare professionals. So this therapeutic pessimism is also one reason why people with a lot of ailments, especially psychological ailments, do not take adequate treatment. And the final one is lack of access to healthcare. So now that we have seen major problems in old age, let us move on to old age and addiction. So a person who's more than 60 years old or more than 65 years old and has an addictive disorder, there could be four possibilities how this person is having this addiction. One is the person who are addicted since adulthood, since his 20s or 30s, they started using substance and they are still continuing it even beyond their 60s. Second one is persons who are addicted since adulthood. Previously, they were using a lot of substances. Now they are using a less quantity of substances, but still they are using it. This is one category of people. Third category is people who are used in adulthood, but later they stopped it. Maybe from age 30 or 35, they would have stopped it. They would have recovered. But later again, when in their 60s, due to some other stress or due to some other loss, they restart again in old age. This kind of people are also there. There is fourth kind of people who are very interesting and who are slightly lesser in proportion. They develop the addiction in the old age only. Initially, they did not have addiction. They develop the addiction in the old age. So all these four different possibilities can be there when we see a person with addiction in the old age. So below are few facts about old age and addiction. One is often the prevalence and effects of addiction on senior citizens are underestimated by both people in the family and both people, healthcare professionals. And older adults, even with less quantity of alcohol, they can develop more intoxication. When they were in their 40s or 50s, they might have been taking 1/4 of alcohol daily without
Doctor, again, your internet is.
issues. But when they cross the STs, the ability, I think maybe I would turn off my video and I'll
That
continue
will
with
be
only the
good,
audio.
doctor. That will be excellent. That will be excellent.
Sure.
Yes.
Sure.
Yeah.
Sure. So older adults, their body can't handle alcohol or any other drugs the same way they handled in the adulthood. So even with less alcohol, they can develop more intoxication and they can develop more side effects. And psychiatric issues like depression, dementia, etc., can be aggravated by addiction. So doctors and healthcare professionals are so unaware of screening and treatment of these disorders and visits the doctor for some other reason like high BP or high sugars. Or pain, etc. And the old age person also feels very much shameful to disclose their alcohol use or their smoking. They are very shy to take treatment. They are very shy to accept to the doctor that they're using alcohol or they're using smoking or they're using etc. Whatever. So it is a fault from both the sides. It is a correctable issue from both the sides of the doctors, healthcare professionals, as well as from the side of the patient. And addiction can make a lot of problems in the old age worse. So what are the risk factors? Do all adults who become older adults develop addiction? No. There are few people in the old age who have risk factors, they can develop addiction. So these are the various risk factors. One is isolation. People who are used to living in a family setup, used to living in a extended nuclear family or a joint family setup, the moment their children leave their house, they go into isolation. They don't know what to do further, and they become lonely. All their friends are either becoming disabled or their friends have already passed away. So they don't have anyone to share what they in their mind. So this leads to isolation and loneliness. And various losses. The losses can be many things. It can be a financial loss. It can be loss of their husband or their wife. It can be loss of their close relative, close friends. Various losses also happen during this time. Stress from medical issues, as I already mentioned, all medical issues, they put a strain on these people. They limit their freedom to move ahead, to move. So all this puts a person in lot of distress. Then they refuse to seek help. Even they refuse to agree in front of the family. Even if family someone comes to offer help, come let us go meet a doctor and tell about alcohol use, they won't take. They are not very keen to take help. And misuse of prescription drugs. This is a major issue. Whenever they visit some physicians, they are advised some sleeping pills. The physician might advise for only a few days or few weeks, but they start taking it regularly. And this also becomes a problem. So along with the sleeping pills, they can also abuse painkillers, antihistaminics, etc. And sometimes they themselves go to the pharmacy and they ask, I'm not getting sleep, just give me some medicine. So all this over-the-counter medicine, their use also increases in adulthood. Especially these painkillers, when they take too much of painkillers, it can land up in issues in the kidney, which often go undiagnosed until the late stages. So apart from people with old age are also prone for addiction, anxiety, etc. So these psychiatric problems, when by taking alcohol or by taking smoke, they are trying to handle it by themselves. This is also one of the reasons why addiction risk goes up in the old age. But how is addiction in the old age different from addiction in other ages? So as I already told, lack of access, a lot of shame and guilt in taking the treatment, and amnesia. Even with normal aging, some kind of amnesia happens. Amnesia means forgetfulness. They forget how, they forget their day-to-day events, forget their recent events, or they forget their immediate events. What happened that day? What happened the previous day? They tend to forget. So this leads to, when the doctor asks about how much alcohol they take or how much cigarettes they smoke, this can lead to they may not remember how much they are actually smoking or how much they are actually drinking. So they may report very less quantity of substances. And sometimes people will be in denial. Denial means I'm not willing to change at all. At this stage, if I change, what is the use for anyone? If that comes, let it come. This is what their attitude is. This attitude is called denial. And also, family members are often takes in his own room, or this person takes outside from somewhere and then come home and sleep. The family may not be completely aware of this substance. And there is a belief in both the family and in the old age persons that medical issues are more important. If the person has chest pain, they'll panic and they'll take them to a doctor. But at the same time, if the person is using smoking, they'll just say, "Oh, it's a habit. Nothing much will happen. He has been smoking for a long time. Nothing much will happen." So this is towards medical issues being more important.
Doctor, again, there is, your voice is breaking, doctor. Doctor, your voice is again breaking.
Just give me a minute.
I think you might have to go to the old previous slide. Again breaking.
Hello?
Yeah, can you just go back?
Hello?
Yeah, it is better now, doctor.
Yes. The previous slide, sir. Okay.
Previous slide. Previous. Earlier to this one. Earlier. Still earlier. A lack of shame and guilt. Denial. Doctor, you may have to start from the denial. Am I audible, doctor?
Yes, sir. Yes, sir. Am I audible, sir?
You are now. You are now.
Yes, sir. So denial is when the person denies to take any help for their addiction. So they may think, even if I take any help right now, it is already too late, and it may not be meaningful when I take treatment. So the person may refuse, even if the family tries to help them, even if the family tries to take them to a doctor for addiction, the old age person denies it. This is called denial. Next is the family members could be unaware of the substance use. Many a times, these people in old age, they may hide their substance use. It won't be The family won't be aware of it. They may either take alcohol outside the house and then come back to the house and they sleep, or they inside the house they may keep it secretly somewhere and they may consume it. So the family won't be unaware unless the person develops some complication like jaundice or some other issue. So that's also one reason why in old age addiction is different. And some belief that medical issues are more important. This means that if the old age person develops some symptoms like chest pain or headache, something like that, the family members may take them to the doctor. But if the same person says, I'm not able to quit the smoking, I'm not able to quit the tobacco use or alcohol use, then they may not take them to the doctor because they think smoking or alcohol are less important and medical issues are more important. So this is also one reason why it is different. And also masking of symptoms. So sometimes both uh, diabetes and alcohol use both can produce things like tremors or lack of sleep. Person has, say, for example, lack of sleep, it may be attributed more to uncontrolled diabetes, or it can be attributed more to their joint pain. Oh, Tata has joint pain, that's why he's not sleeping. So they may not think of alcohol or tobacco being the reason behind the withdrawal symptoms. I told about withdrawal symptoms. Uh, for example, if the person does not take alcohol, they have some symptoms like lack of sleep or shakiness or anxiety, etc. Many a times, these symptoms are masked by the physical illnesses. So this masking of symptoms also leads to under recognition of addiction in old age. There are various types of addictions in old age. The most common are alcohol and tobacco. Sleeping pills and over-the-counter medications are second most common. Then other drugs like ganja, etc., are less common in old age. And behavioral addictions like excessive internet use, gambling, gaming are also less common in old age. Let us focus on a few addictions. One is alcohol dependence. So there are no safe limits for alcohol in old age. Some textbooks they give one drink per day of around some 30 ml, maybe safe in old age. But there is a lot of data suggesting that even a smaller amount of alcohol in old age can lead to a lot of physical complications like liver problems. So apart from physical problems, alcohol can also cause psychological and social effects. So first, let us see about the psychological effects. Psychological effects means repeated drinking can impair the person's memory, and repeated drinking can impair the person's ability to recognize emotions. So people who drink regularly, they get angry so easily. They get annoyed by even small things. Uh, they get frustrated by small disappointments. So all this can lead to frequent anger issues, frequent physical and verbal abusive behavior, etc. And also, people who drink excessively can also land up in psychiatric problems like psychosis, or they can land up in symptoms like hallucination, delusion, etc. And also depression. Social effects means that due to the drinking, their reputation may go away, or due to frequent fights happening in the family due to alcohol use, the reputation of the family, society, their respect in society may go down. So this is called social effects. So based on these three effects, we can divide drinkers into three types. One is low risk drinkers, social drinkers, or moderate drinkers. So in this type of low risk drinkers, they drink only during some occasions, like some parties. Every few months or every few weeks, they may drink. And during the drinking, they are able to restrict to only one drink. So these people are called moderate drinkers. Their physical, psychological, and social effects are less. Second category is at risk or excessive drinkers. Like people, whenever they get an opportunity, they drink too much, or they drink very frequently. Weekly, few days they are drinking, something like that. So these people's drinking puts them at excessive risk. However, the risk has not happened. For example, these people may be drinking and driving also. These people have increased risk of falls. We know in old age, one of the main reasons for fractures is fall, and alcohol can increase the risk of fall. So this second category is at risk of all these problems. Third category is when dependence has already occurred and these people are not able to control their use and they already have some medical complications like liver disease or gastritis, memory disturbances, etc. So there are three groups: low risk, at risk, and dependence group. So based on the group they belong to, the treatment also changes. For low risk, brief intervention or few sessions of counseling itself is enough. For at-risk drinkers, some treatment may be needed. For some medicines may be needed. And for dependence, definitely a combination of medicines and counseling, both are needed. So yeah, and alcohol dependence, people with alcohol dependence or at increased risk of liver disease, pancreatitis, falls, accidents, cancers, stroke, heart attack, and high blood pressure. Psychologically, they are at increased risk of anxiety, depression, and suicide. So to talk about suicide, um, many suicides that happen in old age, the person are found to have alcohol use or some form of substance use as a comorbidity. So next, coming to cigarette smoking in old age, this is another main issue. 1 in every 5 smokers in the world are above 50 years of age, according to a global survey. So this, and right now, people who are adults who are using smoking, in down the line in few decades, they'll all come to the old age people with smoking. So the burden of people with smoking is only going to increase in the coming years. And smoking causes high physical and psychological dependence. So I'll tell you the difference between both. Physical dependence means the person, if they stop using the substance, they develop a lot of physical problems. Like we would have seen many people without a smoke, they are not able to pass motion. Without a smoke, I won't be able to be active. I won't be able to feel active. I'll feel very tired and lethargic. So all these are features of physical dependence. Psychological dependence means they'll have a lot of craving, lot of desire to use smoking as soon as they wake up. Some people, if you see, once they wake up, within a few minutes, they'll start smoking. That means their dependence is very high. So smoking causes both physical and psychological dependence. And excessive smoking can land the patient in stroke and heart attack. And also it increases the risk of lung cancer, throat cancer, and oral cancer. But this smoking has a very wonderful solution available. So the one is the counseling to reduce their craving, and one more is nowadays all these nicotine chewing gums are available. And for old age of the teeth or teeth hygiene is problem, then nicotine lozenges are available. These are like chocolates that are kept in the mouth. They give the similar like smoking, but they do not have the bad effects of the smoke. So these are excellent options available. And for people who don't want chewing gum or don't want lozenges, we have stickers called patches. They can just stick it on their shoulder or stick it on their back, and throughout the day they will not have the craving. So these are some good treatments available which can be utilized for old age.
Doctor, is it available only for smoking or is it available, are they available for other disorders also, doctor?
For tobacco only, it is available right now, sir.
Only for tobacco.
Only for tobacco.
Any excessive use of tobacco can be controlled by these methods.
Yes, sir. Yes, sir. It is very safe and generally it is well tolerated. They do not have.
That's a very good information, doctor. That's a very good information.
Thank you. So,
can it be given by any any doctor or only?
Can be given by any doctor. It can be given by any doctor, sir, not just by psychiatrist.
I see. That's good, doctor. Excellent,
yes.
Doctor.
And also, cigarette smoking in old age, there is a common misconception. So, let me tell you a big truth in this forum. Many studies that are based on whatever it is. It could be a psychiatric illness, or it could be an addiction, or it could be any medical research. So many a times the old age people are neglected from the study. They are excluded from the study. For each study, we have something called inclusion criteria, exclusion criteria. And one of the people who we exclude is the old age people, because it is difficult to take the drug, thing like that. So the research on all these treatments and other things in old age are limited. So in the textbook, the information the doctor gets during training are also limited for old age. They apply the same thing they learned for adults in the old age also, but it does not work that way. So one common misconception is that only in adulthood, if they stop smoking, they can prevent heart attack, they can prevent stroke. In old age, we can't do anything. This is what the misconception that doctors like me, we generally have. So, but it is not so. Even in late stages, even when the person is 65, person is 70, quitting the smoking or quitting the tobacco, quitting alcohol is beneficial. And it has been also been proved in some recent studies. But the only thing we need is active screening. The doctor or whoever seeing the patient, they have to actually ask for alcohol. Even if the patient says, no, 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 I'm not using alcohol, they have to probe them, and they have to give them a space to confront about the alcohol use and to talk about their alcohol use or tobacco use and what advice they need. So brief intervention means the doctor just talks to the patient for 5 to 10 minutes or maximum 15 minutes. These brief interventions are not like daily counseling or weekly counseling. So many studies have found that even talking to the patient for 10 to 15 minutes regarding the smoking or regarding the alcohol can be very beneficial too. So these are called brief interventions, and these brief interventions are very effective. Coming to the next important addiction, sleeping pill addiction. So often the sleeping pills are started by the doctors, but the doctor does not tell how long they have to use it, or lack of. For example, the person may have sleep disturbances due to many reasons. It could be due to the body pain, the joint pain, or it could be due to depression. It could be due to anxiety. It could be due to the withdrawal effect of alcohol or smoking. It could be due to some other reasons, like they had a stressful event, they lost their spouse or they lost their friend. There could be many reasons. And for each thing, specific treatment can be given. But sleeping pills, just providing sleeping pills can give a temporary relief. But for long term, no, many of these individuals, for example, they were taking one tablet of a sleeping pill and they were sleeping peacefully for 1 month. After 1 month, if they take the same pill, their sleep is not the same. Again, they have sleep issues. Then the doctor increases the sleeping pill dose. And for some people, it is extremely difficult to maintain the same sleep cycle throughout. And some alternatives like sleep hygiene techniques, and this chamomile tea is one is a type of green tea that is available. This green tea,
Can you just come again, doctor?
chamomile tea, sir. It's called chamomile. I'll just type it out.
Oh, please, doctor, please. It will be useful to all the participants.
Chamomile tea is one good option. And also there is something called melatonin. This melatonin is now available as tablets, but it has to be taken only with doctor supervision. So this melatonin option, all these options, these are not habit forming, but some sleep tablets, they are habit forming. So this habit forming means that once they start taking, just like how I told, even when they stop taking the sleep tablet for 1 day, they will experience very unpleasant side effects. They'll experience side effects like burning sensation in their body, excessive tremulousness, palpitation, etc. So the sleeping pill, once the forming thing, and they can ask for what are the other alternatives. Nowadays, many other drugs are available which the doctors can prescribe, which are not habit forming. And if those drugs are, and also the doctor has to find the cause. If the cause is due to depression, then depression has to be treated. If the cause is due to alcohol issue, then alcohol has to be treated. So sleep is often a symptom, and underlying the sleep be some other issue. If it is due to pain, then adequate pain relief should be given. So, sleeping pill addiction is the main issue in old age, and we have to identify what is causing the sleep issue and treat that core issue. So, coming next, is other addictions, cannabis, gambling, is the other thing. Cannabis, often called ganja, is often rolled in a paper and it is smoked. So, very common in old age in our country, but people who are using it adult age, they can continue to use cannabis.
Again,
The world. Yes, sir.
again, your voice is breaking down.
Actually,
So, you might have to state again what is cannabis.
hello, sir.
Cannabis.
Yes, sir. Yes, sir.
Ah, yeah.
Can you hear me? Yes, sir.
Yeah, now better. Now better.
Cannabis is actually called ganja, sir. It is taken from plant called Cannabis sativa. So these leaves are rolled in a paper and they are smoked. You would have heard people using ganja.
Yeah, very
Very
much.
popular drug among the youngsters
Yes,
and some adult people also. So this is not very common, but in some parts of India it is common. And next comes gambling. Gambling, there are a lot of ways to gamble. One is the common card game that we are aware of. But nowadays, a lot of this online rummy and other platforms are increasing.
yes, doctor. Very sad. Very sad.
Yes, sir. Yes, sir. And sometimes we show these old age people also in the advertisements that they are playing and they have won a lot of money. So all this gives very false hope to the people in old age, and some people. So that also we is one category of addiction that we see. Then other illicit substances are very less common in old age, like cocaine and other drugs, IV drugs, injection drugs, and all. Very less common in old age. So now let's come to the solutions.
Yes, doctor. Yeah.
One is the see, there are various ways of looking at problems of addiction. One is the we say supportive therapy. This helps for people with like let us say, for example, the old age person has lost his husband or lost her wife, lost her husband or his wife. So what happens is that when their intimate partner, it puts them in a lot of negative emotions. They are not able to share what they think, or they may be living with their son or daughter-in-law, and they are not able to freely express their feelings and emotions. And many a time their friends and other same age people, they either expired or they are also having some disease. So all this puts the person, makes them feel unfit for the society or unfit in the family. And everyone has their own priorities and they are moving ahead. For example, their sons, daughters, they have their own children, and they are mostly focused on their. So no one is there to talk to them. No one is there to help them cope up with the stress. So that is when supportive therapy can help. Supportive therapy, one way is the therapist, by regularly meeting the old age person, offers solutions and offers a space for the old age person to express their emotions. So during the sessions, the old age person may
Again breaking. I think doctor is again gone out. Let's wait for the doctor to join back, sir. Kindly wait. I think his internet is not giving lots of problems. So in the meanwhile, many people have raised lots of issues in the chat box. See, one important question I find is that digital addiction have same type of withdrawal symptoms. So then addition in other activities may also be explained. Money, position, luxury life, then comparing others, etc. That is also one kind of addiction. Then the third one is, see, some person has written, his relative is 85 years old, watches some YouTube whenever is free. Approximately, it is about 3 to 4 hours a day. Not sure that it is addiction. Can we have to interfere? Mostly she will be watching some related to programs related to temples or upanyasam or etc. Please suggest anything we have to do. Most of the time she will not be listening, rather watching. The youngsters have to be motivated about these addictions. Then Chemalan tea is that, and melatonin. And online monthly should be controlled by the government. And the clubs for parties are not increasing. The clubs for parties are increasing trend. Both husband and wife are joining. That's a very beautiful, yes, observation. See, once upon a time, yes, there was somebody to say, the family was such that if one was there, the other used to just take care. So now, slowly, both are going there. So what is going to happen? The future is very bleak.
As time is over, we have to conclude.
Time is also over.
Yes.
What is happening is that see, I would suggest rather, I'll just put it across to people in NIMHANS that we will again have this program once more. Say maybe this Thursday or Friday or something like that. So I am sure that by that time I will also be good. I'll be also. Therefore, we can, because today I think this internet is playing lots of tantrums for him. It's one of the very good lectures that I have come across. Yes, beautifully analyze all the topics. See, from the senior citizen angle, this is something very good. One of the best lectures I have come across. He has taken so much of pain.
Now doctor is coming. He can conclude.
Yeah, let's see. Let us see. Shyam has come. Yes. Doctor?
Mic is some problem, networking problem.
Yeah. It is all ultimately. Doctor, you are back?
The message is coming, he is joining like that.
Yeah.
Actually, sir, I am not able to upload my document.
Okay, doctor. See, what I would suggest is, doctor, see, this time is also up. See, I will suggest you one thing, doctor. I will just raise the questions that are there in the chat box. Number one. And again, I'll try to talk to these NIMHANS people and try to have this lecture once again. It's a beautiful lecture, doctor. In fact, one of the very good lectures that I have come across in my life. We have so painstakingly analyzed everything. It's unfortunate that the internet is not cooperating with you. And because of that, the people are also slowly leaving. So I would request NIMHANS and Nisha madam to again restructure this program once more so that we will have it again, doctor. Is that okay, doctor?
Sure, sir. Sure.
Sure.
Maybe the treatment part, we can have it a separate topic on treatment, how to approach these disorders, something like that.
That will be excellent, doctor. That's a very good suggestion. Yes.
Yes, sir. Now that we have seen about the problem, we have listened most part of it, the treatment part alone, we can have it as a
Another
separate.
Another day, doctor. But
another session.
So, doctor, in the meanwhile, see, there are some questions, very interesting questions in the chat box.
Yes,
I-
sir. Yes. Please tell me, sir.
Digital addictions have same type of withdrawal symptom. That is what person has asked. Is digital addiction, Somanarayanan has asked, is digital addiction have same type of withdrawal symptoms? What is this digital addiction, doctor, first?
So digital addiction, sir, like any substance, previously, um, actually the concept of addiction is evolving. Initially, the addiction term is used only for alcohol, tobacco, etc. But now various, even ever since the advent of touch screens, whenever they have seen, they have studied that the light that we get out of the touch screen, the light itself sends a signal to the brain, and sometimes it can release this chemical called dopamine in the brain.
Dopamine. Okay, doctor.
So, and when we see something that is more interesting, then dopamine goes to a certain level and we feel happy. For example, when we listen to some good song or when we watch some favorite movie or something, we feel happiness. This is normal. But for some certain activities, like for example, it could be some games, or it could be some certain particular content, like pornography is one content. There could be other contents also, similar contents that are more exciting, too exciting for the brain. So it releases 100 times, 200 times more dopamine than normal happiness.
Oh.
So this gives something called a high, the feeling of high that happens in the brain. So this leads to digital addiction. This is one way of how digital addiction happens. Like at some point of time, could have given a very good high, and later the person keeps involving in it again and again. For example, let us take the case of pornography addiction. The person started watching pornography when he was a young person. Then later they started watching it regularly, and every time they did it, they felt very happy and they felt the high. But later, whenever some problems happen in their life, they may go back to the same thing. They may try to overcome by the same addiction. So this is one way of digital addiction. There is another way. The first thing that I told was it causes a very high pleasure.
Okay.
So the brain does it again and again. The brain wants to do it again and again. The other thing is mindless scrolling. Nowadays, what happens is we just open YouTube or we just open some reels or some social media. So what happens is that we open it for some other reason. We just want to spend some time. For example, say we have some 15 minutes free time. We open it and we start watching some videos, some reels. But gradually we lose track of the time. We keep scrolling it again and again and again, and we keep watching things that we did not plan to watch. So after 1 hour, after 2 hours, we get the idea, oh, we have watched so much today. So this is called mindless scrolling.
Yes, doctor.
This
Doctor,
mindless, yes, sir, tell me, sir.
after 2020, children are addicted to watching
Yes.
mobile phone. After
Yes, sir.
2020,
Yes, sir. Yes, sir. Yes.
parents are not able to control the people because they are also watching the same mobile.
Correct, sir. Correct, sir. Especially after COVID, lot of issues have happened. And nowadays, all learning has become digital learning. Then it is
Yes.
becoming more and more difficult. But it is actually very adverse. It is actually very, it can have its own health consequences. So, but the way to handle this is giving adequate breaks, sir. Like even if they engage in digital watching, planning it, and during the break, the parent or the family members also have to involve. For example, half an hour they are allowed to watch, means that half an hour the family can also watch. But later, after the half an hour, when we are restricting for the children, we also should change to some other activity. Like we can also read some magazine, or we can also do some activity with them. It is more like a collaborative effort than we can't
Yes.
blame them also for using the technology too much. Even we are also using technology too much, and now for everything, technology is being used. More responsible use, and as a family, you can have some policies, or as a
Yes.
community, you can have certain policies like no cell phone after 7 o'clock,
Yes.
no social media, and delaying their age of entry in social media. Nowadays, in social media also, these people, the age of entry has been reduced to 13.
Yeah,
So just on 13 people are entering. So all these are, with, but they also understand also, sir. If we explain in a proper way, they also understand. And mainly it is the problem with some of their friend maybe in social media getting more like. So he also wants to do it. So it is mainly a problem of that also, especially in adolescents. Once they come to the teenage,
One thing,
becomes-
doctor,
Yes, sir.
employees and retirees are having two different thinking. But
Yes, sir.
while working in service,
Yes, sir.
that's a main problem for the people in need of service.
Yes, sir. Yes, sir.
But after 60, anybody can use it. But the people in the office, hospitals, and other important places, they are watching, they are neglecting the people in queue in
Correct, sir.
needing services.
Correct, sir.
Whether
Correct,
they
sir.
are watching important one or otherwise the person could not assess.
Yes, sir. Yes, sir. Like you're saying they're using digital technology in the during the work time.
Yes,
Yes,
they
yes.
can be avoided during working
Yes,
hours,
sir.
particularly
That
10
is
to
what-
6 p.m. like that.
Yes,
And
sir. Yes, sir.
lunch hour or leisure hour they can use. But always many people are seeing mobile during
Yes.
service period, working hours.
True, sir. True, sir.
Yeah,
Nowadays,
even,
many
yeah,
institutions.
we have seen one loco driver was watching a mobile phone at the time of accident, but now it is proved that he did not watch like that. So yesterday paper,
Oh, okay.
one
Okay.
great accident in Orissa,
Yes, sir. Yes,
the
sir.
issue was raised that loco driver was watching a mobile phone and
Yes, sir.
neglected his duty. It was allegation.
Correct, sir. Correct, sir. Many a times it is often seen as a very normal thing, but it can also have its very own consequences. And that's why now many institutions, they are coming up with policy also, sir. Policy of use of mobile phones and other things clearly stated. So that can actually, if these people are more aware of those things, then accidents like this can be prevented. So every institution, be it any workplace, be it office or it's a healthcare institution, all this has to be strictly followed and monitored.
Yes, doctor. See, yes.
Because our meetings and discussions should reach the persons who are in public service.
Yes, sir. Yes, sir.
Public service means government service and as well as public service.
Yes, sir. Yes, sir. Yes, sir. We are aware about the issues, but we don't know how to proper redressal
Yeah.
system. Yes, sir.
In camera, we have to discuss all these things during our review meetings and other things.
Yes, sir.
One more question he has raised is, see, addiction in other activities may also be explained, that is money, position, luxury life, comparing others, etc., comparing with others, etc. But do you call this addictions, or do you call this mind concern, mindset problem, or something like that?
The addiction.
How do you classify this, doctor?
Sir, I didn't get exactly what you told, sir. You said comparing ourselves with others.
Yeah, we are comparing ourselves with others, and
Yes,
what happens, we also say that, okay, I mean, we were in a particular position, we were worried about that position, we were
correct.
we were very rich, we were about our richness, we are very conscious about that. These kinds of feelings, it's also causing some kind of a problem. But do you call them actually addiction, or
This we do not call addiction, sir. We do not call addiction.
we do not call it an addiction, isn't it?
Addiction. Yes, sir. Yes, sir.
It is only a mindset problem. Addiction.
Yes, sir. Yes, sir. Yes, sir. If we keep thinking about the same thing, then we call them as rumination.
Yes, correct. Rumination.
Yes, sir. Yes, sir. Yes, sir.
And only one more question, doctor, I would request you to answer. See, one more surprised that his relative is watching YouTube for 4 to 5 hours per day.
Yes, sir. Yes, sir.
It does not affect her routines or routines. Now
Yes, sir.
this addiction. Can we have to? Do you think that is it? I mean, it is.
Sorry, that lady was not given company by the family members to talk with them. The senior most person is,
Yes,
I
sir.
think, his mother-in-law of the person in question. Nobody
Yes,
is interacting with her. She is watching. What is the wrong?
Yes, sir. Yes, sir. Yes, sir.
Okay, you are telling. See, can you call this an addiction, doctor?
It is not
We-
coming at addiction.
We
Because
can't
every
call it
person,
Yes, sir. Yes, sir. It is just the way she is engaging herself.
Yeah,
We
exactly.
can't call it that.
yes,
And we might have seen many old age people in our own families spending their time on something. Like some old women, they spend time on stitching, or they spend time on reading some spiritual books,
yes.
and they so like that they.
Doctor, in other words, she is not disturbing others.
In a way, I am actually happy that she has evolved so much so that she watches YouTube, she chooses her own
Yes,
channel,
yes.
and like that. She
Okay.
keeps her happy, something like that.
Yes,
But
let her
but if the
enjoy.
person, but if it is like the other options are available, but still she's preferring only YouTube, then it becomes slightly problematic. Otherwise, I think we need not call that as addiction. So once for example, she has been given a purpose, like she has to take care of the children or share stories for the children, some other productive work she's given, then if she's able
yes.
to change it, then it is not addiction.
Yes, nobody is
Then also-
listening. Nobody
Yes,
is listening, seniors. Nowadays, because all are having mobile phones.
Yes, sir. Yes, sir.
So thank you, doctor. See, it was a very
Very interesting, doctor. We will meet another session also with you.
Sure, sir. Sure, sir. I'm very sorry for the network fluctuations, sir. My workplace, often the Wi-Fi goes off in between. I'm very sorry.
I will
Next time we shall plan in a better way, sir. I'll be more prepared next time.
Doctor,
Thank you. Thank you very much, doctor. Thank you very much, doctor, for listening us. Sir.
Thank you, sir. Thank you.
Doctor, only one thing I would request you.
Tell me, sir.
I'll just share my number,
Yes, sir.
900
Yes, sir. Oh, 1 second, sir. I'll just note it down, sir. Yes, sir. Tell me, sir.
089
Yes, sir.
97977
90089.
8997
Yes, sir.
977. My name is Jampunathan, doctor. Normally, I used to be the moderator for these sessions. What has
Yes,
happened
sir.
for the last couple of days or for 4 or 5 days, I am not well. Therefore,
Okay, sir.
I did not take your number from the NIMHANS team, and I did not talk to you, give a preparation about you, and give an introduction about you, etc., etc. Sorry for that. So,
No
doctor,
problem.
I will definitely, change. Give a fitting this thing for this, doctor. Kindly share your number also on this for this number, doctor.
Sure, sir. Sure, sir.
So
Thank
we
you,
will
sir.
again on the next lecture. Before the next lecture, I will speak to you, collect some
Sure,
data
sir.
about you, so that give you a good introduction about you, doctor. Because
Sure, sir. Sure, sir.
I feel that I have not done my job. I am
No problem, sir. No problem, sir. Fine, sir. Fine, sir. Thank you, sir.
a very wonderful lecture, doctor. My prayers to God to shower on you and your family. All that are the best in life, doctor.
Thank you, sir. Thank you, sir. Thank you very much, sir.
Thank you. You work in a college or you work in a hospital, doctor?
I work in a medical college, sir.
Medical college, Saveetha Medical
Saveetha, sir. Saveetha.
College. Oh, Chennai.
Yes,
Okay.
sir. Yes, sir.
Okay, fine, doctor. Fine.
Thank you, sir.
I will kindly share your number. Then I will talk to you, doctor.
Sure, sir. Thank you, sir.
Thank you. With your permission, can I close down the session, doctor?
Thank you, sir. Thank you, sir. Sure, sir. Yes, sir.
God bless you. All the
Thank
best. All the best to all. Thank you.
Thank you, sir.